During Breast Cancer Awareness Month, doctors say it's important to understand the disease and how it can impact you or someone you know. Joining me now is Shahla Masood from UF Health. Good morning. Thank you for being with us.
Good morning.
First starters, tell us a little bit about how breast cancer is treated for those who are diagnosed.
Well, currently with the advances in breast cancer diagnosis and therapy, the overall outcome of patients with breast cancer has changed across the globe. Because if it is detected early and managed properly, breast cancer is no longer a fatal disease and is regarded as a chronic disease. So all our effort has been placed in trying to increase awareness of the public about signs and symptoms of breast cancer, how to refer early, and also try to better understand the nature of the breast cancer in each individual patient. The reason for this statement is we have really recognized scientifically that breast cancer is not a single disease. It's a family of the disease, and it is different in every individual patient. In that setting, our job is to find out what kind of breast cancer a patient has, what are the genetic makeup of that breast cancer that make it possible for us to provide an individualized, personalized therapy for that individual patient. So in that setting, the responsibility of the physician is to educate the patient about that, and the responsibility of the patient is to become very familiar with the kind of cancer they have and better understand their options for therapy. In this setting, studies have shown that when patients participate in their treatment decision, they often do much better because that is their right to do, and the more they know, the better they can make that decision.
And how important is it for family members, friends, their support group to also really understand their treatment and diagnosis?
Well, this is at most important because, as I indicated, since every cancer is different, there are cancers that it is truly very manageable and the patients live long life and they do not really have to worry about that. There are cancers that they are aggressive, and those are the ones that fortunately we have the capability by science and education and everything that we have to try to identify those patients and provide them with more aggressive type of therapy. These days, breast cancer is no longer just a disease that you go and you go to a surgeon and they remove the tumor or they remove your breast. Right now, with advances in chemotherapy and radiation therapy and biological therapy, we have the capability of identifying a specific targeted therapy for each individual patient, and they have been associated with really great results in respect to prolonging the life of the people and reducing the chances of tumor recurrences and for the cancer to come back.
And next week, there is a free online event. Tell us real quickly a little bit about that.
Well, for the last 20 years, University of Florida at Jacksonville have been really very committed to provide public breast health education, and we have had this event that we have a dinner, and there is a multidisciplinary group of individuals that they come and ask questions about breast cancer. This year we cannot have it, and we have changed it to a virtual event, and the concept is to once again have a multidisciplinary group of our breast cancer experts from different disciplines to be available and talk about what breast cancer is, how it is detected, how does it become treated, and at the same time have the opportunity for the public to ask questions. That is on October 22nd, and we are really looking forward to have a large number of people to participate and help us in this process of educating the public about breast cancer.
Doctor, thank you so much for being with us this morning.
Thank you.
And for this interview and more about breast cancer, including early detection and treatments, go to our website, news4jax.com. You can find the breast cancer awareness section under the features tab. It is 9:21 on your Saturday morning. We'll be right back.